continue without any significant changes at this time. We also know that the chairman of the Joint Chiefs, General Mark Milley, he convened a meeting in the tank, which is the room here in the Pentagon where the senior military leaders get together and meet. Convened a meeting this afternoon with the other members of the Joint Chiefs of Staff, and he had the combatant commanders, so that's the regional military commanders all around the world, dial in via secure video teleconference, and they spoke through this transition process. They were then dispatched out, the individual Joint Staff members, Joint Chiefs, members of the Joint Chiefs and combatant commanders, to call their various counterparts all over the world, reassure them that, in fact, the Pentagon's going to continue to run. There is now a new acting Secretary of Defense, but everything is continuing apace. It is become very clear from speaking with defense officials here that they want to reassure the American public that nothing has changed. The leadership here may be changing over, but everything else here, as far as operations, continued mission, continued goals, is continuing as it was before, Allison.
Courtney, what a sobering thought you just brought up. I mean, for anyone who thought that they had a lousy Monday or were stressed out today, you didn't get the nuclear code, so we're all probably having an easier day than Christopher Miller is. What a sobering thing to have happen to you. Could you tell us a little bit more about him?
So he's been the head of the National Counterterror Center here in Virginia for about 3 months now. He took over in early August, so not a whole lot of time. He's a retired military lieutenant colonel. He served in the 5th Special Forces Group, so he's a career Special Forces officer. He actually has done time in the Pentagon in civilian capacity as well. He served here in a policy position in this in Special Operations Low Intensity Conflict, what's here called here SOLIC. So he has focused largely on the special operations component. Beyond that, as far as his positions on any issues, we don't know a whole lot about him. But the one piece of guidance that we have so far, Allison, is that he has said he's not planning to come in and make any major changes in the 70 odd days that he has left during the Trump administration.
All right, Courtney Kube, a lot going on at the Pentagon today. Thanks so much for the update.
Thank you.
Pfizer announcing today its coronavirus vaccine is more than 90% effective in preventing COVID-19. The medical community applauding the news, but saying we still have a ways to go.
I was expecting a vaccine might be 70% effective if we were lucky. So this is better than I was expecting. It's still early in terms of production. It's going to take some time to get the vaccine out to the American people, but this is clearly a positive step forward.
If it truly is 90% effective, it could have a dramatic effect on this pandemic in the long run. It's not going to help us this winter, but it could be a real game changer.
Such a long time. I haven't seen you since before the election. Wonderful to have you back on. And we have a whole lot of COVID news to get to today. So let's talk about this Pfizer news. It's based on early data. This trial is still going on. What important information do we still need here?
It's so nice to see your adorable face, Allison. Yes.
Right back at you.
So yeah, you're absolutely right. So the preliminary data from 43,000 volunteers from 6 different countries has shown some really there with measles and chickenpox vaccine levels of efficacy, unbelievable. And in addition, this particular vaccine targets the spike protein, which is the part of the protein of the virus that anchors or attaches to the human cell, invades it, and then allows it to infect. This is good news because even Dr. Fauci said that the fact that we're using this as the target, the spike protein, means that it's an effective, wise target. In addition, the technology, this mRNA vaccine or messenger RNA, it's the fact that it's working at 90% efficacy tells us that this platform, this mRNA platform, can be effective. And the other good news is that Pfizer said that this is going to be free to the public. So we have a lot of promising news here. But Allison, I also have to share some other areas of caution. So first of all, we need the actual original data, not just a press release. So we have it, and we don't know how frequently this vaccine needs to be administered. And then the other issues are really logistical. So remember, these are 2 doses that need to be given 28 days apart. And it has to be shipped and stored at minus 70 degrees Celsius. That's going to cause a lot of limitations, or we just have to ramp up and build the appropriate infrastructure for this. But all in all, Allison, I think this is really promising news. The other issue, though, is that it's not available yet to the general public.
Officials across the board have been warning about a dark winter ahead. We heard Dr. Besser in the intro saying that this probably won't do much to change that. Do you agree there? Is there any impact this could have in making this winter less problematic, or will we just not likely have a vaccine widely distributed before the winter's over?
Yeah, I wish I could tell you that it's available now. And actually, the Pfizer CEO did say that they'd have about 50 million doses maybe by December, but no, the message still needs to remain the same. And in the earlier footage that you showed, I'm so glad that President-elect Biden is talking about the other preventive measures that are really the only things that we have. You got to still wear that mask, and you've got to maintain that physical distancing of 6 feet. Allison, those are the two things that really must happen. You're absolutely right. By all measures, this winter period is going to be a dark one. We're already seeing record high 130,000.
Yeah, Dr. Roy, it is incredible how the cases just kept creeping up, but we were also distracted with the election. Coronavirus really not going away at all. The director of the World Health Organization congratulated Joe Biden on his victory this weekend. Here's what else he had to say. The administration withdrew from the WHO, but the president-elect's transition team says that he will reverse that decision on day one. Can you just explain to our viewers the importance of the U.S. renewing its partnership with the World Health Organization, especially during a pandemic?
Allison, I cannot emphasize this enough. If you recall, on Saturday night, President-elect Biden said during his speech from his home state of Delaware, the first thing he was going to do is get control of this pandemic. And one of the second things he was going to do is reinstate our relationship of the U.S. with the World Health Organization. It's important for viewers to understand that the WHO plays such a major role in facilitation, in coordination with multiple countries, not just vaccines, but I mean, other medications, healthcare workers. I mean, it does a lot of work that just frankly doesn't get media attention. So reestablishing this relationship is going to be absolutely key, Allison.
Dr. Roy, President-elect Joe Biden also announced his coronavirus advisory board today. What else would you like to see from the Biden administration as it's preparing to tackle this pandemic?
Yeah, well, I'm already very reassured because one of the many things he said throughout his campaign, and then again reinforced it on Saturday night, is just he's going to listen to science. Science is going to drive policy. And looking at the transition team, his coronavirus transition team, full of really highly qualified scientists, physicians, doctors, scientists, as well as people that are experienced in taking care of vulnerable populations, people of color. So all of this is highly reassuring. And he also mentioned this in the footage that you showed earlier. He's not just focusing on like prevention as he should and vaccines, but also testing, contact tracing and testing, and all the other measures that are needed to handle this highly complex pandemic, Allison.
Dr. Roy, as you mentioned earlier, it is easy to get excited when we hear positive news about the vaccine today. I mean, here in New York City, it's a gorgeous day. It's warm out. It's hard to even think about the tough winter ahead, but a pretty as a result, because of the work-related exposure, they brought the risk of illness back home to their family members who could have been elderly, who could be children, immunocompromised family members. So the new administration needs to work really hard to protect people who are at increased risk, including people of color, Native Americans, elderly. We already know all these factors. The work needs to be done, though. Dr. Roy, so great to see you. I know we'll be talking to you much more in the days ahead. Thanks for being back with us.
Great seeing you as always, Allison.
Stocks hitting record highs today in the first day of trade since the presidential election was called for Joe Biden. Pfizer's vaccine news giving the markets a huge boost. Take a look at the Dow close, up 834 points today. We are getting ever so close to 30,000. Let's bring in Investopedia editor-in-chief Caleb Silver. Caleb, this rally was pretty straightforward. It was about two things, primarily the coronavirus vaccine news, but also Joe Biden's victory. Tell us more about what happened on Wall Street today and what investors love so much here.
Sure. Markets were ready to rally as of this morning. Futures were up early this morning. And then we got that positive news out of Pfizer and BioNTech, and markets shot up. They closed 3% higher. They were up twice that amount during the middle of the day, smashing records for the Dow Jones Industrials and the S&P 500. But what's odd is that it was the recovery rally stocks that were doing well, and it was the technology stocks that sold off. And we've seen that pattern over the last 2 or 3 days. The better the economic news, the more hopeful our investors are for the economy to reopen up, the better we see recovery stocks like airlines,